analysis of normal constituents of urine. Write down everything, almost everything, note it down. Have you purchased any practical book? You better you purchase one practical book so that you can read also, and that will be easier for you to understand. And you can note down, of course, in the class. If you have a book, then there is not much to note down, because that same thing will be available in the books. Only thing is that you try to, that is a small book, try to read that book completely, so that you will understand what is there in the book and what else has to be noted down in the class. So you note down all the points. Practical book, there is a book of Dr. S.K. Gupta or Dr. D.M. Vasudevan. You can purchase both the books, but purchase the latest edition. That will contain several information, several new things, and all the mistakes which were committed in the previous edition. So always you purchase a book, always do not try to read hard PDF or any soft copy. Keep a book with you. That book is a reference book, and it will remain, and you do not lose that book throughout your life. Unfortunately, my MBBS books were destroyed by termites. I regret for that. But all my undergraduate books were there till 2020. Only the biochemistry Harper book somehow was saved, part of it. I can show it the status of this thing. So that book you keep it throughout your life, because you underline it so that you can recall. And these basic information which you will be reading in the first year, second year, will be all required in your future classes. You can always refer. What was there? I studied, yes, cholesterol metabolism, I studied urine metabolism, I read. What is this thing? What is this? Something new. So, analysis of normal constituents of urine will cover only the chemical part. Basically, it is a chemical part, but since biomolecules are involved also, so that comes under the purview of biochemical reaction. Chemical means purely chemical. Biochemical means which is having some biological component in it or organic component in it. Like if you say glucose, it's purely a chemical entity. Glucose is a molecule, chemical molecule. But biomolecule proteins are biomolecules. So that is a biochemical reaction. So if you analyze protein, that will be chemical. If you analyze glucose, it will be chemical. If it is protein, then it is biochemical. So normal, see, you must know what is normal. The problem is that there is so much of variation among normal individuals, that you don't know how normal is the normal. If I take what is the average height, you will tell something, average height, but suppose you are a little bit shorter than somebody else, than their counterpart. Are you abnormal? So that normal, abnormal things has been mentioned, but in a given situation, you have to judge whether it is really abnormal or really abnormal, really normal or really abnormal. So you need to see the variation. Next time, what I will suggest every one of you, you try drink a little water here, or in the, at your hostel, and collect your urine somewhere here. I do not want anybody's name. I'll give some test tubes. You just keep it somewhere. You just pour that urine and leave it, so that these 50 urine samples you can see, and you can see the normal variation in color, normal changes. If you do not see the normal variation, you will never know. Even in your daily life, you collect some 7 or 8 tubes, or collect some this type of 12 bottles. Every time you go to the toilet, you collect the urine and keep it there. Note down time. Now, after 24 hours, you observe. So you are observing your own urine. You can observe your parents' urine also. So these are almost all normal. Now, if you find someday that if it is red, if it is yellow, very yellow, despite taking adequate water, so something abnormality is there, and you will be able to detect it. And this is discardable item. So you do not have any pain. So it gives very valuable information. So how normal is the normal height? How normal is the normal food? How normal is the normal menstrual cycle was a topic at AIMS New Delhi in 1988 to the first year students. It is a seminar. How normal is the normal menstrual cycle? So much variation is there that they could not identify what is the normal thing. So anyway, you have to note down somewhere some normal thing. Grossly abnormal is an abnormal. So how urine is formed? All of you know during your from class 9 student that this is produced by the kidney from nephrons. So nephron is a basic unit and it is having, so what is globulus here, it's a tuft of capillaries, blood is passing through the afferent arteriole and then it is filtered, the globulus, and that filtrate is passing through these tubules. It's a long tubule. And then it passes through the collecting duct and then finally coming to the ureter. I have not taken the class of urine. Once you read urine formation, you will know the functions of each part of the tubule. Now, if the normal function is disturbed, then you are going to get an abnormal urine. And if you do any abnormal type of thing in a normal situation, suppose you are doing some strenuous exercise, you have withheld water, or you have taken some amount of extra food, you have taken a diet, so that will be reflected in the urine also. Because then in the normal individual, that functions will try to differ in somewhere other than otherwise normal individual, normal functioning is there, but that is normal. So what happens here basically, many things are absorbed, some are secreted, and every day almost, every minute almost 1100 to 1300 ml of blood is passing through the kidneys, both the kidneys. So per minute, suppose 1 liter. So per minute, it is per hour, it is almost 60 liters. So per 24 hours, it is almost 60 to 24, 14,000, 40 liters blood. We are having 5 liters, but that is getting recirculated. Out of which only 100 to 170 to 180 liters of glomerular filtrate is formed. But at the end, what we get? We get only 1 to 2 liters, and on average 1.5 liters of urine per 24 hours. So where this 178.5 liters water is going? These are reabsorbed. And the amount what is present in your blood, the constituents, and the constituents if you analyze in the urine, this will be grossly different. Because this is a basically after all excretory product. So whatever body doesn't require, that will be excreted. And in the glomerular filtrate, many things which are present in the blood, the plasma basically, will be filtered and body will try to reabsorb all those things. Otherwise, the valuable things will be lost. The glucose, it will be absorbed. Amino acids, it will be absorbed. So otherwise, this will be lost. So that is the basic function of nephron. And once you complete the urine formation, if you require, and the abnormal classes, abnormal constituents of urine also, if you require, I will be happy to take one more class where you can ask any amount of questions. I will be glad if I cannot answer your question, because basic objective of joining a career of teaching after leaving an administrative or other assignments, because I want to learn from you. I am interested not in teaching, but to learn from you, ask questions, and if I fail to answer that question, that will be an element for me to read something more and more seriously and more sincerely into the depth also. So you please ask question, and I will not feel shy at all in front of all of you that I don't know. But the moment I will know, I will inform all of you. So now note down this thing. The glomerular capsular filtrate, that capsule, that structure, is having the same composition of plasma. What I told, basically these are all now in writing. It contains all which are colloids. Colloids are very large molecules. They are retained. They cannot be filtered. So, excepting colloids, lipids are non-polar substances. Non-polar means which are not soluble. They are retained in the blood. They are, returned through the other side of the capillary, that is afferent arteriole. Efferent arteriole and afferent arteriole. Afferent arteriole is entering and efferent arteriole is going out. So, fully formed urine, as I told you, it is quite different than the composition of a plasma. This is what I told, these are now in writing. Note down. So, in 24 hours, as I told you, the total volume of blood filtered, basically glomerular filtrate, basically, the glomerular filtrate is about 178 to 180. There will be some variation because we take variable amount of water. So, there is a 10 liters of difference we have measured, because food contains various amount of water. So, urine formation is 1.2 liter, that approximately 1.5 liter, you remember, that's a daily urine capacity, normal water intake, normal sweating, normal respiration, everything is normal. Some substances are present in the glomerular filtrate, but practically absent in urine. Suppose I have taken a drug, medicine for some reason or other. So, drug will act in the body, it will be metabolized, and at the end it will get filtered through the kidney. So, that drug will be excreted in the urine. And at times, if you want to do a renal function test, you have to inject something, and that injected material will also be excreted. So, some substances are present in the glomerular filtrate, I told you, like glucose, amino acids, all those things, but are practically absent in urine, normal urine. You understand and write down. Some of the solid constituents in urine are much more in concentrated amount. The urea is present in the blood. Urea is an excretory product. Creatinine is an excretory product. So, we have to get rid of our body of urea. So, the concentration, some substances are more in the plasma. And again, in a short while you will see that urine is having different constituents like blood. So, these will not have the same concentration. The total quantity of some solid substances in the urine is much more than that of glomerular filtrate. Blood is slightly alkaline, that is pH is 7.4. So, urine, the glomerular filtrate is also 7.4, but normal urine is acidic. So, some amount of acid is being added in the tract. If there is no acidification, that means abnormality. So, normal urinary reaction is acidic. Okay, একটু তাড়াতাড়ি লিখবো, অনেকক্ষণ লিখতে হবে তাহলে, ঠিক আছে? The urine is basically, as I told you, it is an excretory product of the kidney. Okay? Formation of urine is a complex process because there are several parts of the nephron and each is having a different function, and it reflects basically kidney function and other metabolic functions in the body, because in the body metabolism is going on, and that metabolic end products are thrown into the blood just like river Ganges or something in the river, and from there again in the pumping station water is being sucked and the water is purified just like that. So, urine is discarded for every patient. It's a normal finding. If any patient comes, just get an urine examination done casually. You will get a normal finding, might get a normal finding, you might get an abnormal finding. If a normal finding is there, then at least on that date, till that date, the patient did not have any abnormality. So, anything abnormality which you have found, occurred after that date. So normal report, a normal report in any individual is of historical significance. Historically, a patient was normal till that date. It is available, discarded, but very good source of valuable information. If you don't get anything for research work, simply collect the urine from the patient and go on examining microscopically and chemically. One day or other you will find something new, wherever you are. Don't think that whatever written in the book is the last word of wisdom. You can add something, that is what research is. In a peculiar geographical zone, you are seeing something in the urine. Maybe chemically, maybe some physical parameters also, microscopic parameters. But there is no symptom, you can report that thing. That is Sundarban area or in the Darjeeling area or some other places, some abnormality is found. So analysis is done normally chemically, biochemically, what I told you, explained in detail. So most of the tests which we will be doing for the urine is basically qualitative. The difference between qualitative and quantitative means whether it is present or not. Quantitative means exact quantity. Suppose whether this bottle is present or not, yes, present. Now what is the weight of this bottle? You can say that the bottle is weight might be say 20 grams, but exact weight requires weighing in a weighing machine, and that is what is quantitative. This is approximate weight is basically semi-quantitative. Suppose this test tube, you will have some amount of idea about its weight. Visual experience, that is semi-quantitative. You will do all these three things: qualitative, semi-quantitative and quantitative. Is this part clear? Pathological will not discuss because this is not the purview of pathologist. That is a microscopic examination and it requires stain. Microbiological is basically bacterial. Whether there is any microbial element or not, that is done by the microbiology department, but it is usually covered by the pathology department. So we will concentrate only on chemical and biochemical part and not the other two. This part you remember. Why this is important? Because none of you will examine urine. But you must know this thing, P's and Q's, everything, because this will be done by somebody, some of your assistant, maybe a ward staff, ward by nursing staff, and or some laboratory staff. They are likely to commit mistake. Their level of knowledge is not same as of you. You must understand that thing. So, how urine is to be collected? It is to be collected in a clean container. It's properly washed, thoroughly washed. And it must be very much clean. So what you can do cleaning job. Normally this type of water might have any constituents. So best thing is to use it boiled water and then allow it to cool down so that the sediment gets filtered. So on from the top you get and wash it. And other thing you can do, you can pass a little bit urine on it and simply wash it, throw it. So the best thing, urine, you have washed it with your own urine. So there is no chance of contamination. So it is either you can use it in some container, or there is this type of commercially available pots are available from the shop. In the resource poor setting or where this is not available, you can purchase this type of container. It is available freely in the market and you can use it. Only thing is that these are all clean, only wash it properly and collect it. Normally done in overnight sample, morning sample, routine examination, because the urine is more concentrated. In the night, urine we pass relatively concentrated urine. Almost 2/3 of the urine, total volume of urine is passed during the daytime and 1/3 is night time. So the constituents will be a little concentrated, more concentrated, so abnormality will be much more if you take a morning sample. So initial part you discard because there will be some contamination in the urethra, and then you collect the middle part of the urine. So this is basically within the bladder. So this is basically just like a glass of water. You are simply removing the top if there is any dust and dirt, and then you are collecting from the middle. Usually 20 to 30 ml capacity is sufficient, but different laboratory, as you can see, there is a variation in the size. So the laboratory which you will be using, they will give you this type of container and you have to fill it up to this mark. Here this is up to this mark. Now if you take it, you can take it in a container like this and they will collect whatever they want from this sample. The middle part of the stream is called midstream. That means after you pass initial part, the middle of the stream, along the path of urinary stream, you hold that container. So that is basically midstream. Random means normally, as I told you, it is normally done in the overnight sample, but if there is an urgency, patient has come, or if any examination is required, immediately you do a spot urine examination. Means collect it right now at 11 o'clock or 12 o'clock at night, doesn't matter. But that is basically done during emergency situation. Or there are some parameters which are done for the spot urine. That's why I use as emergency or otherwise. You will, in a short while, you will know what is the otherwise situation. Most important is to be analyzed as early as possible. Otherwise, you refrigerate. Or keep it, first and foremost, after collection, keep it in a cool place. Do not put in the hot area or in the sunlight because that will warm up the thing. So, constituents are likely to change. Bacteria might grow. So, else if you have to store it in the refrigerator. Suppose you are in a rural, in a home setup and there is only one fridge where you keep food materials. Now, I am sure that your mother will not allow you to keep the urine there. You wash it thoroughly. That's a practical problem. You explain it thoroughly, you say, clean it, you explain to your mother what is the problem of keeping this thing in a container. If you are so fussy, I am telling you, don't tell her anything. Put it in another container and close it, keep it in the fridge, take it out. I mean, some amount of intelligence you have to exercise. Basic purpose that otherwise constituents will vary. For chemical examination, sterility is not a required factor because we are not doing any bacteriological study, culture study. So, normally it is done overnight sample, but 24 hours collection is done. It is also required for quantitative estimation of several parameters. It is done in a container because urine volume is approximately 1.5 to 2 liter, as I told you. So, better collect in a 5 liter jar. If the volume by chance exceeds 2 ml, 2 liter, then it will be difficult. So, 5 ml will be sufficient. And while you will be giving the sample, basically what we do, we take a 5 ml container, 5 liter container, mix it very properly. It becomes very easy to mix it. Rather, 2 liter full means you have to discard this thing, that thing to mix it properly. But 5 liter is very, very easy. That's why I always prefer 5 liter jar and with a properly tight line. And every time you pass the urine, you collect it in a container and put the urine in that jar. So that will carry a 25 liter jar. So with preservative in that case, because 24 hours you are collecting in the room temperature. So what is the actual procedure of 24 hours urine collection? Remember, you will advise doctor 24 hours urine. You have written in the advice, not this advice sheet. You have to instruct properly. Suppose at 8 o'clock, laboratory is receiving samples from say 9 o'clock or 8:30. So what you do? Ask the patient to void the urine at 8 a.m. Discard that sample. That sample will not be taken. From 8 a.m. onwards till 8 a.m. next day, that is 24 hours urine. So after 8 a.m. maybe you are passing urine at 10, 11, 12. That is your first sample. And urine at the end at 8 a.m. whatever the volume, that will complete it. Only problem here I am telling you, collection during defecation. Every individual passes urine during defecation. So what happens, usually instruct the patient properly that you try to pass urine before defecation as much as you can. So that much urine will be collected, and you ask that you make a practice, somehow you have to collect the urine if you pass a large amount of urine, but that volume is also important. If you pass almost 50-100 ml of urine during that period of time, that volume will be missed. Because whatever amount of water you have taken, that has to be noted down, and how much output you have given, that recording will be there. So 100, 200 ml depends. Suppose if you pass 2 to 3 times stool, so some amount of volume should be, there will be mismatch. So that part you keep it in mind. So instruct properly. So these can be collected, urine can be collected in the commercial vial or in the test tube. In the laboratory, usually if you go, the laboratory will give this type of test tubes. So go to the toilet and collect it. For male person it is easy to collect it. But there will be usually, invariably there will be on the side, urine will be there. And they will try to put it in the tap water, water will enter. So that's why I do not recommend this thing. I usually ask them to go to this spot. For females, because of the anatomical structure, it is very difficult to collect urine in this type of water. I do not personally recommend. I want a wide mouth tube. Or it will be better this type of tube. Because of the anatomical structure, we are helpless. We cannot collect in the test tube. But many local practices go to the and they will contaminate. And invariably there will be urine on the hands. It is invariable, you cannot avoid it. Old age patient bedridden, difficult situation. So you have to devise your own method. Remember, for female patients, try to give always a wide mouth container. Is this part clear? So that 24 hours collection is basically for qualitative analysis. It is not done for qualitative test. So common preservatives, you remember two things, two names of the two things, two concentrated hydrochloric acid and thymol. Bas, finish. Common preservative for storage of 24 hours urine, concentrated HCl or a few crystals of thymol. So 10 ml of concentrated HCl or a few crystals of thymol will be sufficient. And these parameters are usually done in the research centers, in the super specialized center, not commonly done. But 24 hours urine done for Benz-Jones protein. That you will be told during your protein class. If I take the protein class, I will tell you in detail about what is done in 24 hours urine. Write down one part. For 24 hours urine, commonly Benz-Jones protein is done, or the total protein output, Total protein output per 24 hours. Benzones, Benz-Jones protein. First you write down total protein excretion per 24 hours. Benz-Jones protein is done for cancer patients. Total protein excretion per 24 hours. This is done commonly for nephrotic syndrome. This will tell in the protein. Huh? Sterile, খুব এই দেখো খুব সুন্দর কোশ্চেন করেছে। হোয়াট ইজ এ স্টেরাইল কন্টেনার? কোশ্চেনটা করো, তুমি এসো সামনে এসো, শোনো সামনে এসে কোশ্চেনটা করো, বলো তো, let it be on camera. What is a sterile container? দেখো মাথাতে ঢুকেছে কোশ্চেনটা। Here just a question. Sterile container means it will be sterilized. This is basically sterilized container. Sterilization has done, there is no bacteria, no microorganism, no infective organism. It is sealed completely. This is sterile. So if you want to do a culture, bacterial culture, this type of container will be required. It's a sterile container, there is no bacteria. But here this is open, aerial contamination is there, bacteria is there. So if you want to do culture, everybody's urine will be having infection. So that is the difference between a sterile culture and non. Is it okay? So sterile culture is required for bacteriological investigations. Also, a non-sterile container are for chemical examinations. It is, bolo? Yes, question? Bolo, jora bolo. Focus karo dikhe. Jora bolo. I will tell during protein class total protein excretion during in 24 hours. So if you do not collect 24 hours urine. Now you will not know what is the total amount. How will you know? You cannot assess it if you take a random sample, if you take a spot sample. From the spot sample, how much we are excreting protein will not be possible, because there will be variation. The contents of urine vary from time to time in each urination. If you try to analyze, suppose you have passed 6 to 7 times urine in a day or 5 times urine in a day, and if you try to analyze the 5 different urine of yours only, you will not get the same composition, because you have taken food, you have taken something else, you have not taken food, you have drank water, you have taken something, so urine concentration will vary. But that's why that 24 hours urine is there. এই যে কোশ্চেন জিজ্ঞেস করে একটু করে, তাহলে বলতো শুনতে পাবে, ক্লারিফাই হয়ে যাবে। আচ্ছা, বিফোর ইউরিন কালেকশন একটাই ভালো করে বলবো, there will be several persons in a ward setting, so proper labeling is required. So that labeling, car urine, whose urine is this? So at least that, or in blood sample, that labeling is very important. Ensure proper labeling, and there should be marker pen just like this, or marker pencil is also available. So with water, this will not be removed, or indelible ink, or if there is this type of stickers are there, to note down with a small marker pen, fine marker pen, or at least good quality dot pen, so that urine might leak during transport. Possibility is there, so that will, if it passes, the name and everything will be out. So whose sample is this will not be known. Hospital, in case of hospital ID, there will be an ID of patient, just like a roll number. Or if you give it to the laboratory will put a number. This, what is the test tube? A test tube. এই টেস্ট টিউবটা নিল, তোমাকে বললো জাস্ট আপনি ইউরিনটা নিয়ে আসুন, পুরো একটা নাম্বার দিন, হোয়াট ইজ দ্য নাম্বার, আর নিয়ে আসুন তারপর দেবো, you bring the urine, then I will give the number. Possible, because you have given a requisition, they have noted it down, either they will give a number, suppose 12, 13, 14, 16, whatever it is, and they will note it down 16. So 16 number sample, this is your requisition, this is your sample. Or they can done it post facto, because in a hospital setup, suppose 10 persons have come, and 10 persons you have given the test tube. Requisitions are here. What is your name? You have been given last, but you have come first. Or she was a little bit, somewhat confused, she is coming late. So numbering is done according to that is laboratory business. In hospital setup, ID is there, hospital ID is there, patient admission register, that number is to be given. So if there is two same name, same age, the number will be not matching. So after collection, most important thing, cover it with the lid and a stopper, and check it, tighten it, and check it. Because if it is not tightened properly, there will be leakage. And even if it is tightened properly, if the lid is not proper, many times these are plastic materials. Don't think these are all leak proof. There will be leakage. In that case, you have to take either adhesive plaster or transfer it to a separate container, which is having a proper lid, which will not leak. Because if in the laboratory, basically, it is transported from one place to another, normally in a hospital, or if you give it to the collection center, laboratory center, that will be transported from Kolkata or Mumbai or Delhi, you don't know. By train, by bus, by motorcycle, so there will be jerking. So keep it in a cool space, preferably in a refrigerator, I told you. Now if it is kept in the fridge, it has to be brought to room temperature. You can keep it in the room temperature, wait for thing, or put some water in, and then you put it, so it will be faster. And before, after this thing, all I have to shake it properly, so that content which has got settled will get mixed properly. Some substances are a little bit soluble in the little bit warm water. You can touch your urine, it will be of body's temperature. It will be slightly hot, you can see, slightly warm. That with that warm atmosphere, that all the substances are dissolved. Now the moment these are brought down, depending on the room temperature, it is usually 25 degrees centigrade or 30 degrees centigrade. So that temperature is not when the 7 degree fall is there. And in the winter, again, there will be remarkable fall. So some concentration, some contents will be precipitated. So before testing it, you shake it properly and then collect it. So appearance, now note down, appearance, it will be straw colored, normal, everybody has seen, urine is straw colored, or it will be slightly pale yellow, or it is amber color. এবারে কিন্তু মারবো আমি বলেছি, আমি বলেছি মোবাইল অফ করতে, লেখো সব জিনিসপত্র বইয়ে লেখা যায়, বইটা কিনো, বইটা পড়ো, এই ইডিট করো না, অন ক্যামেরা আছে, লেখো না, এটা তোমার লিখতে কি অসুবিধা হচ্ছে, পরীক্ষা হাতে লিখতে হবে, ইউ হ্যাভ টু রাইট ডাউন উইথ ইউর ওন হ্যান্ডস, আই উইল গিভ এনাফ টাইম, নো ইস্যু, write a little faster so that the class can be finished as early as possible. So it will be at least pale yellow or amber color, normal. Now at times you might be traveling, suppose Kolkata, suppose Dharampur, suppose a long distance of 3 to 4 hours without water, or during summer you have seen the urine is slightly dark yellow. Normal person, volume is less and the color of the yellow is a little bit deep yellow. But similarly, if you take a good amount, bolo. Bolo, question, you ask a question. Bolo. একটু পরে বুঝতে পারো কিছু জিনিস ইউরেট ক্রিস্টাল, ইউরিক অ্যাসিড ক্রিস্টাল, এগুলো নর্মালি একটা হায়ার টেম্পারেচারে ঠিকঠাক থাকে, ডিজলভ থাকে, যেই কুল করবে না সঙ্গে সঙ্গে জিনিসটা প্রেসিপিটেট করে দেবে। ওই বললাম যে লাস্ট 8 AM যেটা কালেক্ট করবে, আগের দিনের 8 AM ডিসকার্ড করে দিয়েছো, তাহলে 8 AM পর্যন্ত যা ছিল বেরিয়ে গেল পুরোপুরি। এরপর তুমি জল খাচ্ছ, জলটা কতটা খাচ্ছ সেটা নোট করতে হবে, আর ইউরিন কতটা খাচ্ছ সেটা নোট করতে হবে। 24 hours মোটামুটি একটা ইনপুট আউটপুট বোঝা যায়, হাউ মাচ ওয়াটার ইউ হ্যাভ টেকেন, অর ইফ ইট ইজ পেশেন্ট input output issue is there. If there is no input output issue, then that input water is not required. What is the total quantity of urine you have? Suppose you have taken a drank a little more water, so urine volume will be more, but the protein concentration in the dilute urine will be constant. Why? Because if it is more, if it is concentrated, the concentration will be higher. We will be expressing it in milligram per deciliter. Milligram per deciliter. The total amount will be there, 24 hours we will calculate. That amount will be this much milligram per deciliter. So if it is 1 liter, we have to multiply 10. If it is 2 liter, we will multiply by 2. Okay? At 20. That part will tell you. Just write down, this is basically ABCD of urine. Do not try each and every class will take each parameter one class. Next week I'll take only sugar class, that will be dedicated 1 hour. These 2 hours will be only for one parameter. So cause of urine color, yellowish color, this is common question asked. That you said that this is urochrome or urobilin. Urochrome you just say. Urine pigments are called urochrome or urobilin, but urobilinogen is basically colorless. Remember, urobilinogen is colorless. Urobilin is the product, oxidized product of urobilinogen. Urobilin is the oxidized product of urobilin. If you pass fresh urine, that will be in the urobilinogen form. Now, if you allow it to stand, there will be some amount of darkening. That is because of conversion of urobilinogen to urobilin. So it will impart color. So basically, that's why it is called basically urochrome, and urobilin is the main component. Urobilin is colorless. Urobilinogen and starcobilinogen present in the stool, starcobilinogen is present in the stool, and urobilinogen is present in urine. Both are colorless. Sir, urobilinogen is the oxidized product of urobilinogen. Urobilinogen is almost reduced form. Urobilinogen is colorless. Urobilinogen, when it is converted to urobilin, that is oxidized product, that gives a color. And you can see if it is a dark color, urine will be there if the amount is so high. Normally we are having a slight amount of urobilinogen, very trace amount, because that part you will know also in the later class of That's why just I am giving you an idea. Oh, that I have given it. This is present in the trace amount. Trace means very small amount. It may not be detectable. If you dilute it, no. If it is highly concentrated, you can get a little bit stress. But that is normal. স্ট্যান্ডিং মানে এই যে তুমি এই টেস্ট টিউবটা নিয়েছো নিয়ে রেখে দিয়েছো বা স্ট্যান্ডিং এটা নিয়েছো নিয়ে রেখে দেওয়া আছে কিপিং বেসিক্যালি অন কিপিং এই স্ট্যান্ডিং মিনস ইজ এ কমন colloquial term common term in our medical parlor on standing. Any sample is kept as such means it is on standing. এই যে তুমি বলছো স্ট্যান্ডিং করলে কি হয় ঘটনাটা টার্বিডিটি আছে কি জন্য এই যে প্রেসিপিটেট পরে ফসফেট ইউরিন বিকামস অ্যালকালাইন আর মেইন চেঞ্জেস যেটা হয় সেটা মাইক্রোবায়াল অ্যাকশনের জন্য এই যে ধরো না এই যে মাইক্রো স্টেরাইল কন্টেনার যদি না নাও এই যে মাইক্রো এর মধ্যে আছে ব্যাকটেরিয়া আছে দিস ব্যাকটেরিয়া উইল গ্রো and in the public toilet you have seen typical ammoniacal odor very bad smell why because of the bacterial action on the urine urea is converted into ammonia and that gives a very strong smell and if it is in a closed door proper exhaustion is not then in public toilet you have definitely experienced it the smell is very pungent and it's a peculiar smell because it is from multiple persons somebody is excreting drugs also so that is a mixture it is not pure ammonia so again you asked that question the answer to this question is precipitation of uric acid and urate uric acid is not that soluble it is not that soluble just like glucose the urates they are not that soluble so that gets precipitated so in cool temperature so that's why that need to be mixed here that has to be second is that oxidation the urobilin who I was telling you do you get this answer so everything is written just write completely write down and note down at one point of time assumptions you have if it is not addressed at the end you ask this question okay that will save your time so volume I can tell you it is 1 to 2 liter you remember average 1.5 sir volume ranges from 1 to 2 liter but it can vary from even 0.75 to 2.5 liters with a normal fluid intake because there is a thirst mechanism if you feel thirsty that means there is a less water in the blood otherwise you will not feel thirsty so long you are not feeling thirsty that means there is no deficit in the water in your blood because at one point of time it will be you cannot control your thirst you have to drink water similarly if your system is very saturated you cannot drink no more water no I will not be able to take the no water fine okay so that is a system in the brain which all regulates everything so it depends on water intake how much water you are taking protein intake also protein is finally converted into urea and that urea is excreted now urea is osmotically active substance and because of the osmotically active substance it want more water to remain in the solution so that will cause a little bit more volume intake perspiration during hot water you have seen if there is a profuse sweating and if you do not take water the urine volume is less at times it is very much painful so by the time if you are traveling and you are not taking adequate because there is no urinal maybe true for males particularly for females they do not want to go to the toilet also so it will be very difficult to pass urine so the best thing is at that time is to take adequate amount of water and then you pass the urine when you feel the urge so that minimal volume so every day your metabolism is going on and that metabolites are produced that metabolite needs to be excreted so for that we require a minimum volume of urine that is 500 ml before after that much volume is required otherwise it will not be in the solution and if you try to maintain that thing that minimum 551 I am telling you you are likely to form a stone because that urine will be concentrated every time and urinary stone will be there so you have to strike a balance between the two if you pass one day 500 ml next day you flush it out the urine adequate amount of water 3 liters 3.5 liters doesn't matter because on the preceding day they pass a little concentrated urine So pathologically means abnormal situation. If you have a diarrhea, huge amount of diarrhea is there. At that time you can note down. I think who has suffered from diarrhea, all of you have suffered. There is less formation of urine because water is passed through the GI system. So less volume of blood volume has decreased. So that less glomerular filtrate, so less urine formation. Vomiting again, you are getting out. So blood loss. Blood loss means basically you are losing not only the blood but also fluid. So that will again cause a volume depletion. Volume depletion, blood volume depletion due to any cause will decrease urine output. For other fluid loss, there are other body fluids you can see. So in 24 hours, usually if it is more than normal intake, normal body intake, it is more than 2.5 liters arbitrarily. It is called polyuria. Polyuria means multiple times you are passing urine. It is commonly seen in diabetes. দেখো আমি একটু খুব ঘন ঘন টয়লেট যাচ্ছি অনেকবার ইউরিনের ভলিউম বারবার যাচ্ছি because glucose is excreted and that glucose is again just like urea is a very osmotically active substance, so it will require more amount of water. So the amount of it will depend on the amount of sugar glucose present in the urine. The more the sugar, the more the volume. Similarly, if there is a call, you have seen that diabetes insipidus, antidiuretic hormone is there, which is controlling basically that diuresis. We are not allowing the excess amount of water because water is getting absorbed. If the hormone is deficient, so you will get a diabetes insipidus. So you will pass a huge amount of urine, and of course, this will be discussed later. And chronic renal failure, if the kidney is unable to concentrate urine properly, so it will pass a little bit more volume than desired. And this happens during night only. Day-night ratio, I will tell you, write down here. So, less than 400 ml, if it is there, 500 ml is the optimal limit I have said. So, it is less than 500 ml, or sometimes somebody says it is less than 500 ml. Some books have seen, I have taken it from book. So, even if it is less than 500 ml, you can say it is a percentage oliguria. Oligo means less. So, this is oliguria, unlike polyuria. Polyuria means more. Oligo means less. So, less urine means it can happen again in diarrhea. Acute glomerulonephrosis means kidney disease is there, kidney is not able to function properly. Cardiac failure, heart is not able to pump blood, adequate blood, so proper blood pressure is not being maintained. And fever again because severe perspiration, just like summer. If in the summer there are two types of perspiration, means sweating. If the environment is very hot, you will not know whether you are having sweating or not. But that sweating is there, sweating is getting immediately, that vapor is getting mixed in the circulation. But if it is humid weather, then there will be severe sweating. So that is called insensible. That is one part I will tell you. One is sensible, but you are sensing the sweating. One is insensible. Through the lungs we are exhaling this water also. So that is insensible. We are not realizing. So daytime is collected basically 8 AM to 8 PM, and night time is 8 PM to 8 AM. And usually, as I told you, everybody has experienced that during daytime you pass urine, and in the night time you pass only once urine, you sleep, and then in the morning you get up and you pass one urine. So usually the average is almost 2:1 to 3:1. Chronic renal failure. All these points I will tell you in detail. Chronic renal failure means kidney is chronically failing. There is no remedy. You have to do the dialysis or renal transplant. These are the disease conditions. Deliberately, I have not written to confuse you. This is orientation class only. Okay. Chronic renal failure. One thing, inorganic question, don't forget non-potent nitrogen, and this you must be able to tell. These are asked commonly. What is the non-potent nitrogen component? Urea, uric acid, and creatine. Urea, creatine, and uric acid. These three you must tell. Non-potent nitrogen. Protein we are taking in the form of amino acids. So that each amino acid is having almost 16% of nitrogen, and that nitrogen, extra nitrogen is getting excreted in the urine. And these are the three components: urea, creatinine, and uric acid. NPN is the main constituent of urine. NPN, because this is an excreted product. A creatinine kotheke asche, it is coming from muscle. Normally, urea level varies. If you take more protein, more urea will be produced. But creatinine is coming from the muscle. Muscle is fixed. You cannot change the muscle. So creatinine concentration will remain fixed. So that is a better marker than urea. Urea concentration can vary from day to day. But creatinine will remain fixed because this is dependent on muscle mass. Again, I will tell you repeatedly. So total NPN output is this figure. You need not remember. Only thing is that the maximum amount is NPN. This is noted down, but you need not remember these particular figures. Urea, you must be able to tell. See, if this type of questions are not answered, then you are likely to fail. Before allowing to fail any student, these type of questions are asked. What is the main excreted product of urine? You have to tell urea. And what are the other? What is NPN? You say non-protein nitrogen, urea, creatinine, uric acid. Again, these substances are also present in blood. So these are sodium, potassium, calcium, magnesium, phosphate. Phosphate is coming from three different sources. One is phosphorus from the phosphoproteins. You will tell. I will tell you. Nucleoproteins are there, phospholipid, and inorganic phosphate in the diet. We are taking the phosphate in the diet. So sulfate is there, inorganic sulfur is there also. So what is abnormal urine? Abnormal means normally pathological. Normal means it is physiological. Remember, normal means physiological. Abnormal means pathological, means disease. So normal constituent, if it is present in lower concentration, that is also abnormal. If it is higher concentration, that is also abnormal. Isn't it? For abnormal presence of something, is it not normally present? That is also an abnormality. Is it not a normal constituent in normal urine? That is also abnormal urine. So it can be chemistry, it can be bacteria, it can be cells. Normally we do not sell cancer cells. If cancer cells are present in the urine, there is cancer in the urinary tract. If you find a biochemical parameter which is not normal present in the normal urine, that is a biochemical parameter, that is metabolic abnormality. That excess production is getting excreted. So normal constituents either present in the lower concentration or higher concentration is also abnormality, or presence of abnormal metabolite or protein new substances. One thing is specific gravity, urine. Specific gravity is one parameter that is measured, and that is measured by urinometer. Urinometer is basically measured for, write down, specific gravity is measured by urinometer. Actually, urinometer is like just hydrometer. If possible, I will bring one and I will show it to you. Urine is there, urine is put here. This is, suppose urine is here. We take it in a larger test tube and put the meter here. It will float. And depending on the specific gravity, it is graduated from 1.00 to 1.060. So where it will match, it is that specific gravity. So normally these type of instruments are done in the Western country, and they are calibrated at 15 degrees centigrade, because in the Western countries the temperature is lower. Now we are living in a basically high temperature, so there is a temperature correction factor. So for every 3 degrees centigrade rise, the last 3 digit is added by 1. So suppose the specific gravity is 1.01 at 36 degrees temperature, which is normal temperature of body. Or maybe in the laboratory you can see what is the temperature in the laboratory. So that temperature is there in the urine. So that correction factor has to be added. So suppose difference is here, it is 36 minus 15 is 21. Divide it by 3, 7, then add 0.007. So corrected value will be 1.007. If it is suppose 35 degree, if it is not 35 degree, 30 degree. So 30 degree minus 15 degree minus 15 divided by 3, 5, just add 5. So ambient temperature you have to see in winter and summer, particularly in India, you see to know the variation in the temperature. And in the Kashmir or in Delhi, the temperature goes down to nearly, I stayed there, it was nearly 4 degree. Yes. That day I slept I took a bath in the midnight, 2 a.m. after coming from the laboratory. Then next morning I saw that temperature was 4 degrees centigrade. Anyway, so this is urinometer is for specific gravity. So there is a relationship between specific gravity and what is specific gravity? You know what is specific gravity basically? Specific gravity is basically density of one substance compared to density of water. That's it. So in water doesn't have anything, so specific gravity will be 1. So in anything, in liquid, if you add anything, so that is basically increasing the density. So that is increasing the specific gravity. The specific gravity is basically indicates the presence of solute in that solution. So then more the solute, the more the specific gravity. More the density, more the specific gravity. So osmolality basically determines the actually molecular concentration. This is a mass concentration. So if there is a high specific gravity, if there is no glycosuria, means in diabetes common abnormality we see is blood sugar, that urine sugar. If there is no sugar and if you find the specific gravity is very high, that means it is concentration of either sodium chloride or urea is very high. So urea we can exclude if there is no high protein intake. We can exclude that there. So there will be a problem in the sodium and potassium. So this is of great significance. You note down, in the absence of significant glycosuria, the specific gravity represents a function of sodium chloride and urea. Okay, and there is a linear relationship. Now again coming to the specific gravity, you can see from various books the figures will range. In a normal individual, as I said you, it's wildly varying. Say for 1.001 to 1.040, this much variation. Even some books might say 1.001 to 1.025, because many authors have copied from many books. And in a normal individual, if you take adequate amount of water, it can come down to 1.001. This will be almost just like water. Everything is dilute. Now if you take concentrate, if you do not take water, so that much solute will be there in the urine. The solid load will be increased, so specific gravity will be high. Okay. So specific gravity is measured by a mass concentration, and that is by urinometer. In contrast, osmolality is a molecular concentration of each substances. That Avogadro number, 6.023 into 10 to the power 23. So basically that is a true number. So that now has been replaced specific gravity to osmolality. But osmolality is not done because specific gravity measurement is very easy. In all reports, specific gravity is measured. Osmolality is wanted only when there is specifically desired for some abnormality. Normally it is not done. So protein in normal urine. This question is asked, is protein present in the normal urine? The answer is yes. It is present in the normal urine, but maximum is 150. It is not detectable by the normal detection method. It is present but not detectable. Suppose the choto kagaz ekটু ছিড়ছে হ্যাঁ. Suppose if I take this much paper and put it in the machine, in a weighing machine, will it show any record? Do you think it is absent? It is present, but that there is a limitation of the machine. That machine cannot detect. Now, if you take this thing to a gold weighing machine, the machine will weigh, because that sensitivity is high. If you take it a balance, normal balance, it will not weigh. even the vegetable balance, even in our palm, the chemical balance which we are using for weighing chemicals, because this amount is very less. But if you put it in the actual research laboratory, it will show you weight, how much weight it is. So that depends on what type of method you are using. So it is not detectable by the conventional test. Conventional test ki na amra heat test kori, eta tomar nijera korbe, this we will do, or sulfuric acid or dipstick method. These are the commonly conventional method, but this commonly conventional method is not sufficient to detect that amount. So out of this 150 milligram, 30 milligram per day is excreted as albumin. Total maximum amount. So this albumin is present in micro concentration, smaller concentration. That's why its name is micro, not micro albumin. Albumin, suppose albumin is a big structure and this is a small structure of albumin. No, the amount is present in micro amount. That's why it is called microalbumin. Albumin structure is same. So, is there any other method for detecting? Yes, microalbumin can be measured. There are several other methods are there, and this is also done. And if you go further down in the research laboratory, even much more less concentration of proteins are required. So, for that some research methodology is there, but these are not done routinely. These are cumbersome process. Spot test. As I told you, you can collect a spot urine, and this is commonly done for, write down, spot tests are commonly done for urine ACR, urine albumin creatine ratio. Spot test is commonly done. It can be done for routine examination, it can be done, definitely can be done. But preferred method is basically burning sample. You can run now somebody in doubt in a medical examination, he is giving some false information, you have asked them to collect the medicine. Suppose you have taken one example I am giving you. You have got an appointment, employment in any government sector. Now you are having problem, you are having diabetes, you are having abnormality in urine. Now if I ask you to give the urine, you can keep someone else's urine, you can bring it here and then you can submit that thing, that will come as a normal. If you are in doubt, they ask them, pass the urine in front of me. This is what I do. Pass the urine in front of me. I am waiting outside. I am here. Just go to the keep the door open. In this container, you pass the urine. I want to see. Because manipulation is very difficult, because if you employ a diseased person, it will be a lifelong problem in a government sector. So one has to be very particular. So spot test is basically done for routinely urine ACR. This will be discussed in detail during renal function test. So others are present like chloride, ammonium, phosphate, sulfate and bicarbonate. Physical. This is actual coming to the actual point what are actually required. So long we have discussed long thing about theoretical aspect. Appearance. As I told you, very appearance is most important of any person, of anything. Very appearance. খাবার খাচ্ছে দেখছি খাবারটা খুব ভালো মতো খেতে ইচ্ছে করবে, কারণ নোংরা দেখতে ইচ্ছে করে, ঠিক আছে. Similarly, from the appearance is clear, transparent, there is no sediment, that means this is almost less likely that he is having some problem. So volume, 24 hours volume, you have to measure in a volumetric flask. You have collected in a container, now you have to measure in a volumetric flask to know the exact volume. And note down color. Told you earlier, stroke light or amber yellow, deep yellow can be also there, or it can be watery. Odor, normal odor is light ammonia. Normal urine. If you pass a dilute urine, there will be no odor. If you pass a concentrated urine, the urine smell will be strong. You have noted all these things you have noted. So reaction to litmus, I am repeatedly telling normal urine is acidic in nature. Never say it is neutral. Normal urine is acidic, but it can vary again, just like your height, body weight. And there you can see that it varies from 4.6 to 8. So 8 means it is alkaline. So when it becomes alkaline, when somebody is taking vegetarian or fruit diet, then the urine becomes alkaline. Or if there is a bacterial infection. If the urine becomes alkaline, you inquire what type of diet you are taking. Some people might be pure vegetarian. So in that case, that is normal finding. But somebody has taken high protein. Suppose if his pH is slightly at the lower side, this you inquire. Actually, if you measure it with the pH meter, then you will know the actual figure, just like balance. Now, normally it is done by litmus paper to know whether it is acidic or alkaline. Okay. Specific gravity, I have told you urinometer. You will not forget at least this thing. And what is for osmolality? What is the instrument for osmolality measurement? What is the instrument for osmolality measurement? শুনলো না এতক্ষণ ধরে বকলাম বসে বসে লিখেছ লেখো নি দেখো তো কিছু লিখেছো কিনা খাতাতে লিখেছো কিনা দেখো অসমোলারিটি কি মেশিন দিয়ে করা হয় ইনস্ট্রুমেন্টের নাম কি এই তো মুশকিল না বললাম না ক্লাসে পড়ে মুখস্থ করে নেবে আর পড়তে হবে না if you hear all these things you will not be required to do anything more বলতে পারলো না তো পড়বে So usually আমাদের এতগুলোর মধ্যে what with these 4 parameters are noted: appearance, color, pH and specific gravity. These are of clinical significance. ঠিক আছে দেখা গেল এই দেখো তোমাদের যেটা বলছিলাম chemical composition. Water composition basically urine basically watery component 90 to 95% water থাকে solid থাকে বারবার যেটা বলছিলাম whatever I told you repeatedly urea is present in the maximum concentration. This is 25 to 30 mg. So urea, uric acid and creatinine is the main constituent of urine. You can see the volume milligram per deciliter. These grams per day. So urea is maximum. So do not try to forget to tell that is urea. Urea, uric acid, creatinine, these are non-protein nitrogen. And ammonia is also nitrogenous component. Sodium potassium is also present. Chloride. These are normally among the chemical composition, this urine creatinine is measured because you can see the ACR, I told you, albumin creatinine ratio. So microalbumin is done and creatinine is done to know the albumin creatinine ratio. So this is the only parameter done routinely for routine use for in common conditions. But when somebody is requiring some more very difficult disease, which is not a common disease, and these are usually done by the nephrologist. This patient cannot be handled by a normal physician or normal even MBBS doctor. They usually refer this patient to nephrologists who are kidney specialists. They usually do this type of tests. So ketones, just like protein I told you, ketones is present again less than 100, protein up to 150 microgram I told you. Glucose is also present 150 microgram per day means 24 hours. But this is not detectable by the normal method. Remember, is it present at all? Yes, sir, but not detectable. That's say that much. Protein present in normal urine? Yes, but not detectable. How much? Next question, how much is 150 milligram? What is the amount of albumin? 30 milligram. Less than 30, okay? এইবার দেখো আমাদের শান্তিপুর মেডিকেল কলেজের রিপোর্ট দেখাচ্ছে পড়তে পারছো না আমি পড়ে দিচ্ছি দেখো আমাদের শান্তিপুর মেডিকেল কলেজের রিপোর্ট একটা পেশেন্টের জাস্ট এই কবে করেছে এটা করেছে এই 29 তারিখে এখানে শুধু দেখা ফিজিক্যাল এক্সামিনেশন না এটা ভলিউম প্রথমে লেখা আছে ফিজিক্যাল এক্সামিনেশন ভলিউম আছে কালার আছে তারপর ট্রান্সপারেন্সি আছে তারপরে আছে স্পেসিফিক গ্র্যাভিটি নিচেটা বুঝতে হবে স্পেসিফিক গ্র্যাভিটি এই 5টা প্যারামিটার করা হয় ইউরিন এতটাই বাজেভাবে দিল আমাকে এটা পরেরটা দেখি তো পরেরটা দেখা যাচ্ছে পরেরটা দেখি এটা দেখা যাচ্ছে এই দেখো অন্য একটা প্রাইভেট ল্যাবরেটরি দেখাচ্ছি এটা এখানে দেখা যাচ্ছে কালার অ্যাপিয়ারেন্স স্পেসিফিক গ্র্যাভিটি এই 3টে প্যারামিটার করে ছেড়ে দিয়েছে কেমিক্যাল কি কি দেখাচ্ছে রিঅ্যাকশন দেখাচ্ছে অ্যাসিটন দেখাচ্ছে বায়োল সল্ট বায়োল পিগমেন্ট এই তোমরা যেটা করবে বেসিক্যালি অ্যাসিটোন করবে, বায়োল পিক সল্ট করবে, বায়োল পিগমেন্ট করবে, সুগার করবে, আর প্রোটিন করবে, অ্যালবুমিন করবে, অকাল ব্লাড। মাইক্রোস্কোপটা আমাদের পাটের মধ্যে নেই। সেগুলি ওই একটা ল্যাবরেটরি দেখো, ও করছে বেসিক্যালি এই দেখো কোয়ান্টিটি কতটা হয়েছে, কালার কি আছে, ট্রান্সপারেন্সি, স্পেসিফিক গ্র্যাভিটি, সেডিমেন্ট, হ্যাঁ সেডিমেন্ট অ্যান্ড রিয়াকশন। বলো কোনটা মিলিগ্রামই আছে, কারণ ক্লোরাইড সোডিয়ামের সাথে ছাড়া অন্য জায়গাতে থাকে, অন্য জায়গাতে থাকে, অন্যান্য সাথে আর হ্যাড করে থাকে না। হ্যাঁ গ্রামস, এগুলো সব গ্রামস আছে। হ্যাঁ ক্লোরাইড থাকে পুরো বইতে লেখা আছে, দেখেছি তুমি যদি থাকে তো আমাকে দেখাবে তো ওখানে। আমি একটা বই থেকে কপি করি, নর্মালি এটা করা হয় না বলে আমি আপনার গুরুত্ব দিই। না না ঠিক আছে, হতে পারে মিস্টেক মাইট বি দেয়ার, দ্যাট প্রিন্টিং মিস্টেক। I have just copied it also, so no issue because this book is from I have taken, maybe I have also typed wrongly. This is not done, that's why I don't remember. আর কিছু এটা বলবে, এই দেখো এখানে দেখো নর্মালি এই পাঁচটা প্যারামিটার তোমরা করবে, সুগার করবে, গ্লুকোজ করবে, প্রোটিন, অ্যাসিটোন, বাইল সাল্ট, বাইল পিগমেন্ট, ইউরিন এখানে করানো হয় না, এগুলো তোমরা করবে। These all tests will be done. এটা দেখতে পেলে, এটা দেখা গেছে। সিমিলারলি আরেকটা ল্যাবরেটরি দেখো, ওই কালার, স্পেসিফিক গ্র্যাভিটি, পিএইচ, এই তিনটে দেখে ছেড়ে দিচ্ছে। এখানে করছি কিটোন বডি, বিলিরুবিন, ইউরোবিলিরোজেন, ইলেক্ট্রোলাইট প্লাস করে ছেড়ে দিচ্ছে। তো দিস উইল বেসিক্যালি বি রিকোয়ার্ড। এটা পরে যারা প্রিন্ট আউটটা পেলে তোমাদের নিয়ে আসবে। এইটা দেখো এগেন, এটা বোঝা যাচ্ছে কালার, অ্যাপিয়ারেন্স, স্পেসিফিক গ্র্যাভিটি, reaction, acetone, bile salt, bile pigment, fat, yes, fat, another issue, note down. Presence of fat means it is called, in urine it is called chyluria, CHYLURIA, chyluria. Presence of fat in the urine is called chyluria. Presence of blood in urine is called hematuria. Presence of hemoglobin in urine is called hemoglobinuria. Presence of blood, presence of fat is chyluria, CHYLE, chyle. এই যে আমরা যখন খাই, ফ্যাট খাই, fat is getting absorbed and it forms a chyle, CHYLE. If that is excreted, that is called chyluria, CHYLURA. If it is blood, that is called hematuria. If it is called hemoglobin, that is called hemoglobinuria. If it is myoglobin, then that is myoglobinuria. If it is phenylketonuria body, ketonuria, just like that. এইগুলো অনেকগুলো টেস্ট আছে, এগুলো এই টেস্ট তোমাদের পড়তে হবে না, এগুলো করতেও হবে না, পড়তে হবে অ্যাবনর্মালটা, এটা বলেই শেষ করে দিচ্ছি। ঠিক আছে, এবার বলো কি কোশ্চেন আছে, বলো বলো। দেখো ঘোরাও দিক কোশ্চেন। ব্লাড টেস্টে blood test is altogether, it will give a specific thing for the at a metabolic status of the body. Urine is a part of it. It doesn't reflect everything. But urine gives another additional information which blood cannot give also. But from blood you will get the most of the information. But that is a costly thing, number one. And it will be, you have to prick it, you have to send it somewhere else. Urine is a discardable item, easily available. This can be done in a small setup also. Both are information. Blood gives much more information than urine. But whether kidney is functioning properly or not, from blood you can get. From urine you will get something more if it is exactly involving kidney. Suppose if there is a disease in the kidney where the renal epithelial cells are getting destroyed, and these renal cells will not, these epithelial cells will not appear in the urine. So renal cast these epithelial cells will be found in the urine. So if there is a stone in the urine, that stone will give from a crystal, so crystals will be available in the urine. That crystals will not get in the blood. So that will block the capillary. Nephrologist basically area urine. Nephrologist is basically handling the urea, only kidney part. So we are very much organ specific. One day will come right, some doctor will be specific for right kidney, someone will be left kidney, someone will be cortex for, someone will be for medulla. কোন কিডনিতে প্রবলেম শুধু ইউরিন করে বুঝতো না, বোঝা যাবে না। সেটা তখন করতে হবে, এটা আল্ট্রাসাউন্ড করো, আল্ট্রাসাউন্ড এক্সরেতে বুঝতে পারি, এক্সরে স্টোনটা বোঝা যাবে, স্টোনটা বোঝা যাবে। স্টোন যদি থাকে, যদি রেডিও ওপেক হয়, যদি রেডিও লুসেন্ট স্টোন যদি হয়, তাহলে আল্ট্রাসাউন্ড এক্সরে করে বোঝা যাবে, আল্ট্রাসাউন্ডই করতে হবে। ঠিক আছে, জোরে জোরে বলো। 24 আওয়ার দেখো, ভালো করে শোনা, কোশ্চেনটা বলো, কোশ্চেনটা বলো, কোশ্চেনটা দেখি জিজ্ঞেস করে দাও, বলো। হোয়াট ডাজ ইট মিন বাই 24 hours? Means in 24 hours time, how much urine you are producing, that volume is to be noted, and different these analytes, particularly protein, is measured. How much your protein you are excreting, because in nephrotic syndrome the diagnosis rests on the amount of protein excreted, total protein excreted in 24 hours. That is the determining factor whether the patient is having nephrotic syndrome or not. So for that 24 hours collection is there. Or any other constituent, how much you are excreting in total 24 hours, because the concentration varies in each urination. As I told you, if you urinate 5 different times, and if you study the 5 different parameters, you will get 5 different figures, like blood sugar, blood glucose. If you take 5 different samples or 6 different samples at 6 different times, because at one time you are taking food, at time you are fasting, at one time you are in the intermediate stage. So after you take the food, depending on the carbohydrate intake, the blood glucose level will increase. Then at one time it will reach a height, then it will come down, and if it comes down too much, then you will feel hungry, and at that time you will take food. So again, if you take blood at different points of time, so composition of the blood will also vary, because it is dependent on the diet, it is depending on the metabolic status also. Because during sleep we are having a different metabolism, in daytime we are having a different metabolism, when we are tense we are having a different metabolism, when we are relaxed, that is we are having a different metabolism. Everything will be taught. This is how blood is collected. Come here, come here. How blood is collected?
No, sir. In case of the 24-hour collection, do we take 5 or 6 samples throughout the 24 hours? And then
You have not heard properly. I told you have to collect all the samples in a container and put it in that 5 liter or 2 liter container. Suppose every time you have to take a container of minimum 500 ml capacity, because the bladder capacity is 400 to 500 ml. So you have to take this type of container, you have to pass urine there, this urine is there, you just put it in there, open the lid and put the container there, close it here. And next time again you pass the urine, you put it in the container. So that 24 hours collection will be there in that container. Only one time. Why one time? In 24 hours, how many times do you pass urine? You just tell me. Whenever you pass it, all the times you have to collect. In 24 hours time. And that 24 hours time, after discarding, at any point, you can take 8 a.m., 8 p.m., 9 a.m., 9:30, 10, whatever you is possible, 5, 6. It is dependent on the laboratory. Where you are sending, when it is receiving the time, accordingly you time it. You can time it at 5 o'clock, you can time it 7 o'clock, 6 o'clock, 8 o'clock, 9 o'clock. But you discard that time, from that time till that time. So 9 o'clock to 9 o'clock. So till 9 o'clock you pass the urine, whether you are feeling an urge or not, you go to the toilet, pass whatever urine you can pass. So maybe 2 ml, 3 ml, 5 ml, 5, 6, 10 ml, pass this urine. And thereafter, all the samples have to be collected in a container. For male person with this type of big vehicle are not required. But female size is required. For male, this type of containers are required. You can take a mug, simple, clean mug will be best thing. A clean mug will be best thing. And keep the mug after passing the urine, wash the water with that water, or let it remain with the urine outside, but keep it covered, so that there is no dust and dirt. Otherwise, this dust and dirt again will go, and every time it will be added. You take something which will cover. Maybe one utensil, plastic utensil, will cover it. And next time you go to the toilet, this instruction you have to give to the patient. The patient will keep it open, and dust and dirt will be there. Why I am telling? Because at the end you have to treat the patient. Laboratory will give its laboratory report. So just like that, those two image will be given that the artist has drawn. But you have to manage the case. If you find an abnormal report, and you have to again instruct the patient, go and repeat the test, and patient will get irritated. You will not get irritated. You have collected 24 hours urine, that urine was something wrong. Laboratory will give some abnormal finding, and now you are seeing that dust and dirt is there. Now you have to inquire that why dust and dirt is there. You inquire, they will see I have not covered it. So ডাক্তার আপনি তো বলেননি গো, আমি তো বগটাকে নিয়ে রেখে দিয়েছিলাম, বগের উপরে ঝড় দিয়েছে, ঝড়ে বাতাস পাতা পড়েছে, নাহলে কিছু নোংরা পড়েছে, ঝড় এসে ধুলে পড়েছে, তো তার উপরে ইউরিন পাস করে দিয়েছে, ওটাকে ঢেলে দিয়েছে। Instruction must be very much proper, and that is from the doctor's end. Laboratory will tell in its own way. I am telling you, the knowledge level of laboratory staff, nursing staff are much inferior or less than of yours. So you will be the leader of everything. After MBBS, if you are posted as a medical officer, you are basically the boss. After MD, if you join something, you will be a specialist. So you are the boss. If there is no senior person, so you will be responsible for everything. Even if a junior commits a mistake, you will be responsible. Why? Because he is under control of you. You can guide him. You are there to guide him. If there is a mistake, you just tell them you did properly. You have not guided. Patient is getting annoyed. Now you have to go and apologize. And that is the best way. If there is any mistake, I am telling you, to avoid any confusion, simply go and bend down. Mistake. There is a mistake. I am sorry. I apologize. And that will make the chapter end. Closed. And this is what I have adopted. If you apologize to a patient because of a one mistake, to anybody, be it SDO, be it video, be it whatsoever, even your director, hospital director, sir, I have committed a mistake, sir, sorry, sir. Sorry, sir. Tika. So everybody has got that amount of forgiveness. But if he is so much adamant, and if he is really require the patient investigation report next day, then there is no excuse. So every time you see that no repeat sample will be required. No repeat sample will be required for anybody. Suppose if I ask you, you have to give blood again, you will get irritated. Well, maybe you are a medical student, maybe you are a doctor. But again investigation, again sample. So instruct properly and then inquire from the patient whether he has understood or not, or she has understood or not. Most of the times you have said in one way, I have told in one way, and at the end I asked him, and there is no answer. And that is the usual picture. You told something and the patient has understood something, and he will tell something, he or she will tell something else, which is quite different, which you have not said at all. So teaching patient is another big issue. And you have to tell in their languages what they will understand. That is another important. You have to clarify to a educated person, some SDO, BDO, or DM of any district, and if somebody, a day laborer or a sweeper, or any other class conservancy staff, you have to tell in a different way. The same thing you will tell, because their level of intelligence understanding is quite different. Even in DM, just get a cross check. Sir, did you understand what you have said? Kindly repeat. If you don't mind, please repeat once more. I want to cross check. Don't think that he has heard everything of what you have said. He might be thinking something else, there is district problem, something somewhere else, and eventually problem by the time you have said. So have a cross check. And that is true for medication prescription also. Medicine prescription also. Okay.